Hi, Miss
Hello.
Maria. Thank you for coming on. I'm getting our little technical things going real quick. And also Candace, I'm actually making both of y'all co-hosts. That way, if you have a slideshow to share or screen share, you'll be able to do so. Good afternoon, everyone. Thank you for joining us. We're still waiting on one more of our speakers to log in, and we'll get started shortly. Thank you again for your patience, and we'll be getting started soon. Okay, everyone, we're going to get started here in just a second, but right before we start, my associate, Miss Liv Hoynes is going to have a statement for everyone.
Yes, hi everyone. Thank you so much for being here today. I'm really excited to learn from all of our speakers and merge some of our maternal and oral health knowledge. I wanted to give a disclaimer that we are going to be recording today. If you're not comfortable with that, or if you want to switch off your video or change your name on screen, please feel free to do so now. And yeah, we're really excited to have everybody here.
Thank you, Liv, for doing that. And again, if you wish to not be recorded, we're going to give you about a couple minutes to log off, or you can change your name on the screen as well. But thank you all for coming in today for our session, for our webinar, actually. And I'm just going to give like a couple more minutes for people to log in, and we will get started. Okay, we're going to go ahead and get started. Thank you everyone for joining in today. I'm Dawn Landon. I'm with the National Indian Health Board. I currently am with the Tribal Oral Health Initiative under the Public Health and Policy Project Program. And we are currently going to be having our webinar today for National Children's Oral Health Month and Maternal Health Month as well. We have a few presenters that's going to be speaking here today, and I'm very excited for all of them to be able to take their time with us and to just speak with us on each of our topics that we have today. We will be opening the chat. The chat room will be open for questions, which we will provide a question and answer session at the very end of the webinar. So please, if you have any questions, please direct it to the speaker that you would like to ask, or you can just ask everyone if you'd like. And if we run out of time for the question and answer, we will be glad to take your email and email you the response to those answers. So if you like to have your email sent to it, or I'm sorry, if you like to have either a copy of this webinar or the questions that you posted answered, you can please put that in the chat and we will be grateful to take your questions and to send you the recording of this webinar. Again, this is going to be recorded, but I do want to just give a quick introduction to myself. Again, I'm Dawn Landon, National Indian Health Board, and I do have a few associates that's with the National Indian Health Board, and if I'd like to have them introduce themselves real briefly, I'll go ahead and get started with the ones I see on my screen. First, Liv, would you go ahead and like to introduce yourself real quick?
Sure. My name's Liv. I am on the maternal health team at NIHB, and I'm really excited to, again, learn from our maternal and child oral health experts today.
Thank you, Liv. And the next individual I am seeing is Mr. Nell Springer.
Hi, my name is Danelle. I am the Public Health and Policy and Programs admin. I will also be looking at the chat box and the Q&As, making sure everybody's questions get answered or marked down.
Thank you, Danelle. I'm also seeing Miss Sarah Price.
Hi, I'm Sarah. I'm a program manager on our maternal health team. I'm just in here listening in with all of you. But feel free to reach out to me after if you have any questions about any of our maternal health work.
Thank you, Sarah. All right, we're going to get started with our presenters. Our first presenter is Ms. Pamela Aide, and I'll just have her introduce herself, and she is open to take the floor right now. Thank you, Ms. Pamela.
Thank you so much, Dawn. Good day, everyone. I believe it's afternoon for some of you. I am correct, yes. So I almost said good morning, but I didn't. My name is Pamela Aide. I am a member of the Puyallup tribe of Indians. I am a dental hygienist by trade with about 20 years of clinical experience, and then I was also a clinical dental hygiene instructor. I currently work for the Northwest Portland Area Indian Health Board, which is an NPA IHB, and I am the Dental Health Aide Education Manager. So what that means is I work with this super team called the Tribal Community Health Provider Project, TCHPP, and there will be a quiz on all the acronyms at the end, okay? And what I know, you go into admin from clinical and it's just acronyms, you know, galore. So what our project is doing, though, is so exciting, is that we are working on developing and implementing the community health aid program that has been successful in Alaska for over 50 years down here in the Portland area, which is Washington, Oregon, and Idaho. So I'm working on the dental health aid part of that. And so I'm really excited about that. I'm thrilled to be here. I haven't worked in clinical for a couple of years, and I miss talking to my patients. That's probably the biggest thing I miss, is building that relationship, listening to their stories, them listening to my stories, which was what it was most of the time, because it's kind of hard to talk with your mouth open. so is mostly, but building that relationship. And I would say as a hygienist, probably the most important job I had was helping them learn the best way to achieve oral health and then to maintain oral health. So I was just so excited. Thank you all for allowing me to share this space and for being my patients today. So I did my presentation on Canva, full transparency. I love that it's a small audience. So I'm going to go ahead and try and share, and I'm going to turn off my camera only because I live in Sequim, Washington, which is on the Olympic Peninsula up on the Northwest Washington. And I live in the foothills, and I've got the Elon Musk Starlink, and sometimes it's a little unstable. So just to be safe during the presentation, I will turn my camera off, but when I can, I'm happy to turn it on and answer any questions. Okay, can everyone see this? Because I cannot see you right now.
Okay, I don't have a screen open for that. I'm not seeing it.
Okay, thank
me-
you. Let's.
Okay, now we're starting to see the screen. There we go.
Okay, so this is just a little bit about me. I love the mountains, my dogs, teaching. Down below, those are some students from Nick Yahweh Community School, and I was so thrilled to be able to do like a dental pathways course for the high schoolers. It was a lot of fun. And then this is my family. I have 5 children and 1 grandchild and 1 on the way. And so maternal health is very important to me, and I'm so happy to speak about it. Whoops, let's go the other way. Okay, we're done. I'm gonna go. Sorry, guys. Oral health and pregnancy. So today we're going to talk about oral health and overall health and how it's all related. And we're going to touch a little bit on Native communities and overall health. And then the breadth of the presentation will be oral health and pregnancy, including dental care, nutrition, and prevention. Oral health is the gateway to overall health. It enables us to perform all the essential functions such as eating, breathing, and speaking. It supports our self-confidence, our well-being, and our ability to socialize and work without pain, discomfort, and embarrassment. Essential to oral health, good oral health is essential to overall health and allowing us to be a part of our community and achieve our full potential. Poor oral health, on the other hand, can also affect overall health and well-being, can lead to pain, infection, nutritional problems, speech difficulties, and sleep deprivation, including leading to low performance and missed days at work and school. And if your mouth hurts, you are not at your best, and it's very difficult to complete the tasks you need to complete. Oral health is also the bacteria in your mouth can travel throughout your body and affect all of your body systems. And so some of the health risks connected to a person's oral health include heart disease, cardiovascular disease, dementia, respiratory infections, diabetes, infertility, cancer, and other conditions, including pregnancy complications. So a little bit about Native communities and health. The American Indian and Alaska Native people have long experienced lower health status when compared with other Americans. They have a higher rate of heart disease, cancer, stroke, diabetes, respiratory disease, influenza, and pneumonia. And if you think back to the previous slide, oral health is connected to all of these conditions as well. These health issues have heavily impacted Native communities, their health and their overall well-being. Native communities see health as from a holistic perspective. And so mental, spiritual, and physical is all connected. And additionally, Native communities also suffer from the poorest oral health of any population in the United States. Good oral health can help reduce these chances of getting other diseases later on in life. Oral health affects the next generation. The children of mothers with poor oral health are also likely to have poor oral health as they go through life. During pregnancy, it's so important to make oral health a part of your prenatal care. There are changes in hormonal levels in pregnancy that directly affect oral health. Pregnant women are susceptible to a wide range of oral health conditions that are harmful to their own health and the future of their baby. And about 4 in 10 pregnant women have tooth decay or gum disease. These are some of the conditions that poor oral health in pregnancy can lead to. It can lead to tooth decay, gum disease. Gum disease can make your gums really sore, very tender. They can bleed easily. Pregnancy granulomas, and those are a non-cancerous raised tumor on your gum that can bleed easily, or even ooze, but it's benign. Premature delivery, low birth weight babies, mouth dryness, dental erosions, preeclampsia, and gum tissue ulcerations. And these are just some of the conditions that you can see increase in pregnancy. A woman's oral health during pregnancy is a good predictor of her newborn's risk for tooth decay. Children are more likely, 3 times as likely, to have tooth decay if their mothers have high level of untreated tooth decay in their own oral cavity. And mothers can, and how this is that mothers can unintentionally pass the cavity causing bacteria to their newborns, increasing the children's risk for tooth decay. So poor oral health in pregnancy, why? There are many factors in why this is. We talked about the hormones and increase in hormones, but in addition, during the first months, some mothers may have really strong cravings for specific foods, especially carbohydrates. Nausea can make toothbrushing difficult, and pregnant women bleed more readily due to the effect of the pregnancy hormones, and subsequently will avoid potentially brushing their teeth. And as a result, bacteria increases, and then the bacteria eats the sugar, the carbohydrates, which causes the acid, which causes cavities. And I think that's going to be talked about quite a bit during the next hour or so. Vomiting is another reason why there's poor oral health. It increases the acidic environment in the mouth. And after vomiting, if the teeth are not brushed sufficiently, an acidic environment will form in the mouth. And if you have additional saliva flow decrease, that can cause an environment that promotes cavities. There are many myths about the safety of dental care during pregnancy. The use of radiographs, pain medication, and local anesthetic is safe throughout pregnancy. It's also extremely important to get your oral health taken care of if you can. I do realize that there are barriers. There are a lot of barriers to dental care. American Indian and Alaska Native pregnant women receive less dental care than when they are not pregnant. As a matter of fact, less than 3% access dental care during pregnancy. So if at all possible, get dental cleanings, fluoride varnish, and fillings before the baby arrives. And seeing a dental provider while you're pregnant can ensure that if you have any of those pregnancy-related symptoms, you can also get those taken care of. Nutrition is also extremely important for overall health and for oral health for both the mother and the child. A good diet and good oral health combined will lessen the chance for dental disease during pregnancy. And baby's tooth development starts about the 5th and the 6th week. So making sure that you eat a balanced diet, and you're getting all of your vitamins. I think it's vitamin D and E that's been associated with enamel formation in the baby's teeth. Try to eat a variety of foods, vegetables, fruits, berries, grains. Calcium is very important, and meat alternatives such as wild game and fish. Limit foods and drinks that are high in calories, fat, sugar, or salt. Potato chips, pop, jams, and sugars added to tea or coffee. Those can be detrimental and help promote cavities. And consume as much liquids as possible. So prevention, what can you do at home? Practice good oral hygiene. Brush your teeth twice a day for at least 2 minutes. I will let you know my background in clinical is in periodontal disease prevention. So that's advanced gum disease. And there are some patients that we had brushed 8 minutes, at least 8 minutes a day. It takes a long time to get the plaque off your teeth. You need to reach every surface of every tooth. So take your time. And I have an infographic to talk about the correct angle. Make sure you're brushing with a fluoridated toothpaste. Clean in between with floss or an interdental cleaner. That's this little pink thing down here. There's so many different things like gum picks. If you can't master floss or you have a dexterity problem, there's all sorts of hygiene tools. And if you vomit, rinsing with a teaspoon of baking soda in a cup of water can help stop the acid from attacking your teeth. Additionally, choose xylitol. So xylitol is a naturally occurring sweetener that reduces the bacteria that causes cavities. And studies have shown that consuming xylitol 3 times a day in your pregnancy and continuing after your birth of your child, at least 13 months, significantly reduces the cavities that cause the bacteria that cause cavities in your child's mouth. So xylitol can be found in gum. It can be found in mints. This is just an example of this spry gum over here. I happen to like this spry gum. Okay. The correct technique for brushing your teeth. Place the toothbrush, and I wish everybody had a toothbrush. I'm sitting in front of you. We're going over this. Place the toothbrush at a 45-degree angle to the gums. Move the toothbrush back and forth gently in short strokes. You don't have to push too hard. You want to find like the right amount of pressure, however, not too light, not too hard. Brush the outer surfaces, the inside surfaces, and then the chewing surfaces. And to clean the inside surface of the front teeth, tilt the brush vertically and make several up and down strokes. I also make little circles in there because it's kind of scooped out. And brush your tongue. Flossing. So flossing is the only way besides interdental to get in between the teeth. It's very important. And so you can grab about 18 inches of floss, wrap around your middle fingers, and then use your index fingers. Hold the floss tightly between the thumbs and the forefingers. And I use my index. You can use your thumb, forefingers. I think everybody manages to figure out the best pattern for that. And curve the floss, gently insert it, don't pop it in, curve it to C shape and go up and down each side of the tooth. And don't forget your back teeth. Go way back there, pull forward, and do a little up and down back there as well. So let's talk about barriers. 2.4 million American Indians and Alaska Natives suffer from poor oral health because of a lack of available dentists. One study found that 64% of respondents to a survey had There you go. This is a great infographic.
Sorry,
Miss
I think
Matt?
it froze up for a second.
I did just turn off my video, so tell me when I
Okay.
come. Am I back? Can you hear me now?
You are back
I
now.
can't hear you.
Okay, great. Yeah. So this is a great infographic on Medicaid coverage barriers for pregnant women. In the beginning, you're going to find a barrier if there's no existing coverage or source of care. There's confusion about what's covered, how to enroll it, a limited window of coverage, insufficient medical dental coordination of care or referrals, finding a participating Medicaid dentist who will treat pregnant women, and a disruption of access to dental care after their coverage expires. Solutions: dental health aide therapists, dental, and hopefully everybody has heard of these dental providers. Dental health aide therapists successfully expand access to oral health care. Tribal communities have benefited from the reliably culturally relevant care that dental therapists offer. And here are some of the benefits when they are seen practicing in tribal communities. They have expanded access to consistent, routine, high-quality oral health care. There are more American Indian, Alaska Native providers earning professional wage jobs. It's an excellent educational pathway for them, and a more efficient and effective oral healthcare team that brings care where it's needed the most, inside and outside of the clinic. So they are very well trained in community outreach and getting out to the community, to elders, to Head Start, doing some screening, saying, hey, let's get you into the dental clinic, or let's get you into primary care, whatever is needed. And on that note, a new dental therapy program has opened up in Washington, only the second in the nation, in Skagit Valley College, the DeHivus Dental Therapy Program. And they have their first cohort right now, but they are starting to recruit for the new cohort. So if you've ever been interested in a dental health aide therapy career, or you know somebody, then please reach out. I think that Dawn is going to have all our information, including our emails at the end of this, and I can share this information with her as well. So thank you, be well, and I am happy. These are not all the resources I use are on the slides. These are just some that would be helpful for maternity for pregnant women. Thank you, I appreciate your time.
Thank you, Ms. Pamela. I am so appreciative of what you shared and all that great information. Again, any questions you guys may have, please post in the chat and put the name of the individual that you're asking the question to, and we'll get to your question as soon as we can. And we will answer all those at the end of the webinar. So our next speaker that we're going to have is Ms. Kari Kuntzelman. I'll just have her introduce herself, and we'll just move right along with our webinar. Thank you again, Ms. Pam. I appreciate you.
Hello, are you able to see my screen?
Yes, I can see it.
Okay.
You might need to enlarge it just a little bit. There you go.
Okay, perfect. Let me get this all over here. Chickasaw, hello and good morning. My name is Kari Kuntzelman, and I am a member of the Chickasaw Nation. I think my screen might have froze here. Just 1 second. Okay. Is it changing to the next slide? Oh, there we go. Technical difficulties. I'm a member of the Chickasaw Nation, and I currently live in Estacada, Oregon, about an hour outside of Portland. I graduated from the Alaska Dental Therapy Education Program in 2019. I moved up there with my, at the time, boyfriend, now my husband, and I attended the dental therapy program and then returned home to Portland, Oregon to work for the Native American Rehabilitation Association Dental Clinic. I worked there for 2.5 years under Pilot Project 100 in Oregon as a dental health aide therapist, and I now work with Northwest Portland Area Indian Health Board as their dental health aide education specialist. I recently became the 11th Oregon State Dental Therapy licensed dental therapist, and so I'm really proud of that. That was a really long road for all of us. But today I'm going to be talking to you about how to take care of children's teeth. These are just some pictures of my family doing things that we like to do, getting outside. So first I wanted to start with a question, and some of you might know the answer to this. So I would like those of you that are not dental providers or work in the dental healthcare to not answer this question. But anyone else, if you just want to put the answer in the chat or come off mute and shout it out. True or false, cavities are contagious?
And you can put your answer in the chat.
Right. My computer's gonna work. For those of you that answered, you are correct. The answer is false. So cavities are not contagious. The bacteria that causes cavities is what's contagious. So you can think of it like the common cold. If you have a cold and you kiss someone or you drink after them, you drop your child's pacifier on the floor and I've been known to do that myself with my daughter, and you lick it off to clean it. If you have the bacteria in your mouth that causes cavities, you're going to be passing that bacteria to that child. And that is how that transaction works. I apologize. I'm going to stop sharing and then reshare and see if that will help to reset.
I also have your slides too, Kari, if you want me to try to share those and you can just guide me. Or you want to try yours?
I made some edits to them last night, so I'll try one more time if that's okay.
Okay.
I apologize. I know I don't want to be taking up too much time doing this here. Okay, there we go. I think it's going to work now. So today's objectives, we're going to talk about a little bit about oral health statistics for American Indian Alaska Native children. We're going to talk about why baby teeth are important. We're going to talk about how we can help our next generation properly care for their teeth. We'll talk about some good oral hygiene and oral hygiene habits. And then we're going to go over some tips and tricks for brushing and flossing. So early childhood caries is a disease, worldwide, and some of you may have heard of this before, but we're going to talk a little bit about the statistics. So 5 times as many American Indian Alaska Native children aged 6 to 9 years have untreated dental decay as the general U.S. population in that age group. And these statistics that we're going to be going over is from a recent publication from the Indian Health Service. 4 times as many American Indian Alaska Native children aged 3 to 5 years have untreated decay as white non-Hispanic children. And 3 times as many American Indian Alaska Native adolescents 13 to 15 years of age have untreated decay as the general U.S. population in that age group. And all of this information is really important to understand and know, because cavities are preventable. And we're going to talk a lot about prevention as well, as Pam's presentation as well, because I think for a long time, just in the history of the world, people thought that that cavities were just something that happened. And now that we have so much information to share, we really want to make sure that we teach our patients and patients, parents, whoever is helping the children take care of their teeth, that prevention is the key. So here's some pictures of early childhood caries. On the top, you can see that's normal, healthy primary teeth or baby teeth. The next picture down is chalky white spots, and that's the process to which a cavity is starting, but it's not a cavity yet. So there are other things like using fluoride mouth rinse, and if you're going in for your regular dental appointments, bringing your children into the regular dental appointments, there are other things that they could possibly do, like silver diamine fluoride, and other things that can be done to help stop that process. The next picture down is brown spots, and then the bottom one is severe decay. And again, I just want to reiterate that this is all preventable, and we're going to talk about ways to prevent from cavities starting. So why do children need their baby teeth? They need them to chew properly. They need them to smile, to have proper speech, for self-esteem, and placeholders for adult teeth. And I want to talk a little bit about placeholders for adult teeth. When I was working in clinic as a provider, you know, I would have parents come in and say, oh, they're just baby teeth. It doesn't matter if they fall out. And that is absolutely not true for all of the other reasons that I just stated about chewing, smiling, proper speech, and self-esteem. And then again, for the placeholders of adult teeth. If you have a child that loses a baby tooth sooner than they were supposed to, then the process for the adult teeth that was underneath of that baby tooth is going to start sooner than it would have if that tooth would have remained in their mouth for as long as it was supposed to. And that causes other problems later on. So how do we help children take care of their teeth? By offering them healthy foods and snacks, less snacking. There are recent studies that show that children and adults even that are constantly putting food into their mouth throughout the day, they're constantly introducing like sugars and carbohydrates and different things that can that start the cavity process in their mouth. It throws off the pH balance. And so with having less snacking, you're not giving the opportunity for that bacteria to start that process to which a cavity starts. Limiting sugar intake. And I really don't like to say, you know, no sugar. Kids don't have candy, don't have sugar, don't have juice, because that's not realistic. I mean, I give my child sweets and she gets juice, but we make sure that we brush her teeth. And that's the really important part, is that you can still have all those fun things in moderation, but you have to brush your teeth. You have to take care of your teeth. And then good oral hygiene with regular dental visits, and not just when you're in pain. And that goes back to the prevention. You know, a lot of times parents, children, adults, they won't go into the clinic until there's a problem, but you want to make sure that you're going in regularly to make sure that, you know, that your child is properly taking care of their teeth. So some foods that keep our teeth healthy are natural foods like fruits and vegetables, meat. And even for people with dietary restrictions, myself and my daughter have a pescatarian diet, and we've been eating that since she was born. And so, you know, we do eat fish, but we eat a lot of beans and spinach and other things that have protein, but just really trying to cut out limit the processed foods, because the processed foods are what contains all those things that like to start that bacteria and that process for which cavities start. So some good oral hygiene habits are flossing. And we'll go over some tips and tricks for how to floss children's teeth. I know it can be really difficult, you know, trying to floss a 1.5-year-old, 2-year-old's teeth, but there are different ways that we'll talk about. Introducing fluoride toothpaste as soon as the first tooth erupts. At the end of my presentation, I do have some resources from the American Academy of Pediatric Dentistry that does say that it's completely safe to start using fluoride toothpaste as soon as the first tooth erupts. You just want to use like a very, very small smear and wipe it on that tooth. You're not going to be wiping the toothpaste on their gums, but you'll wipe it on that tooth. And then regular dental appointments again. And then you can begin fluoride mouth rinse as soon as the child can spit. And sometimes it takes some practice. And so you could practice with water before you introduce the mouth rinse. And then fluoride is extremely important. And at the end of this presentation also, I have a link to where you can go and look up in your area if you have fluoridated water. In Oregon, there are only, I believe it was 43 different water fluoridation plants out of over 2,500 that have water that have fluoride in their water. And that's a huge problem, because for those that don't go into to the clinic to get that fluoride varnish application yearly, to get their checkups to make sure that they're properly taking care of their teeth, they're not getting that amount of fluoride that they would if there was fluoride in the water. And I know I'm not going to go into a whole fluoride speech today, but you know, there's a lot of misinformation out there about fluoride not being safe and things like that. But the thing about water fluoridation is it's completely safe if you have a person that works at the fluoride plant that knows how to put that fluoride properly in the system. They have special training and things like that. And when you have someone, you know, adding the fluoride to the water that isn't trained, that's when things can go wrong. But I will go ahead and move on to the next slide. So again, different types of fluoride application and ways to get fluoride is with the drops. This is currently what my daughter is still using, and it's a multivitamin. So it's vitamin A, B, and D, and it has fluoride in it. There are fluoride tablets, again, the water fluoridation. And then when you go in for your regular dental appointments, or even, you know, different Head Starts and early childcare programs, will have providers come into the clinic and do fluoride varnish application. And that can start, you know, as early as the child has the first tooth, and that's completely safe as well. It's just applying the fluoride to the teeth only. And I do want to note that for the multivitamins I apologize, for the multivitamins, that prescription is from a physician, and then you might also be able to get a prescription either from your dentist or from the physician of the child. And so I just wanted to show a couple of really short videos about how to properly brush your teeth. And then I have one to show how to help brush a child's teeth. Let me know if you're able to hear it. Hopefully, yes.
The modified Bass technique of toothbrushing is used by patients that have good manual dexterity and limited gum.
Are you all able to hear the video?
Yes, I'm able to hear it.
Okay.
Is everyone else able to hear the video?
Yes.
Okay, great.
The brush is placed at a 45-degree angle onto the front surface of the teeth, with the bristles projecting into the pocket surrounding the tooth. A small circular motion is made with the bristles into the pocket. Then, the bristles are swept from the gum line to the biting surface of the tooth, brushing over the entire front surface. This technique is then completed on the inside surfaces of the teeth. The toothbrush is once again placed into the pocket at a 45-degree angle, completing small circles, then brushed from the gum line to the biting surface of the tooth.
And I'm going to show this other video. Of course, it's not very practical to do it that exact way when you're brushing, you know, a toddler's teeth or a baby's teeth. So we're going to watch this video here.
We all want to make sure that we brush our child's teeth properly, as this is one of the most important things we can do to prevent tooth decay. From the moment a baby gets their first tooth, right up until the age of 7, they should have their teeth brushed by an adult. Sometimes it can be difficult to know how to brush a child's teeth effectively.
Here is a video of me brushing my son's teeth when he was younger. There are a number of different ways to brush children's teeth. The important thing is that I, as dad, are brushing them. We start in one corner of the mouth and brush each surface of each tooth, and we gently work our way around until we've finished.
For more info, go to oralb.co.uk/strong teeth.
I do want to add, this video stated that until a child is 7, that a parent or guardian should be brushing their teeth. And I don't 100% agree with that, because I think, you know, being a provider working in clinic, I had patients come in that were 12, 13, 14, and they were not properly brushing their teeth. So I'll just say, you know, that it just kind of depends. Some things you can look for is manual dexterity. So if they're able to tie their shoe properly or hold a spoon or a fork properly, then they might be doing it correctly, but you can always still check, you know, as the parent or guardian, you can have them brush their teeth, and then you can go in and brush over or just take a look to make sure. So some tips and tricks, like it was shown in that video, is you can sit on your bed or the floor. I just sit on the floor, and I have my daughter lay in between my legs and put her head up. And, you know, sometimes if you have a squirmy child, you can put your legs on top of theirs, not pushing down to hurt them, but just kind of holding them in place. And then, you know, you could do little things like tickling under their chin, or, you know, kind of making it a game, makes it a little bit more fun for them. Also, depending, you know, on their age, Like now my daughter's almost 3 and she's at the point where she wants to brush her own teeth, and I'll let her brush and then I'll go through and brush after her. Some things for infants, you know, you can use the finger toothbrush. I would caution you, you know, they're at the age where they have all of their teeth and they can start to bite down. Just be careful that they don't bite your finger, you know, but this is a really great starting tool for when they do have their first few teeth. Something else that's super fun is disclosing tablets. And these are things that you can get at your local dental clinic, but you can order them online, like Amazon, Target, you can find them anywhere. The tablets are really fun for kids. They like to chew them up, and then you can have them spit. And then when they smile, it'll show where there's plaque on their teeth still. And so it's a really great training tool to show them, you know, like where they're missing the plaque and to make sure that they're brushing all of it off. Another thing that you can do is tell, show, do. And this is something that we do in the dental clinic, but you can do it at home as well. So, you know, if you're a foster parent or you're a guardian for a family member and, you know, they're not really used to brushing their teeth or having good oral hygiene habits, what you can do is brush your teeth with them. So you can tell them what you're going to do. Like, hey, I'm going to brush and floss my teeth now. Let me show you how I do it. And so you can show them the proper way, and then you can have them do it and show you. And that's what the tell, show, do process is. This really is a great tool in the dental clinic. Dental providers use this to show fearful patients, you know, like what the different tools and things like that are used for, but it can be used at home as well. So before I was a dental provider, before I moved to Alaska for the program, I actually was a care provider for the state, and I worked with individuals with different disabilities, and I had a patient with cerebral palsy and epilepsy, and I took her to a conference and she gave a presentation and she used the term handy capable, and that really stuck with me. I asked her permission before I used it in my presentation today. And, you know, so I just wanted to go over a couple of oral hygiene tips and tools for handy capable children or teens. And so electric toothbrushes are awesome. A lot of people will ask like, oh, which toothbrush is better? And if a child or a patient doesn't have really great manual dexterity, so if they're not able to hold a regular toothbrush and brush properly, that's when an electric toothbrush will come in handy. It's not about really, you know, the fact that an electric toothbrush versus a manual toothbrush works better. It's how the person uses it. And so that's really going to define which one is better for each individual. And then a water pick as well. And they're really affordable now. I think I just saw one for like $30 online. And this is really great if a child or patient has like ortho appliances like braces or permanent retainers, anything like that, or just don't have that manual dexterity. And so here's some resources similar to the end of Pam's presentation. You know, these are just some places that you can go to, some really cute, fun videos to show kids how cavities start, and some more toothbrushing videos, and then recommendations on the fluoride use for kids, and then the water fluoridation link. And there's my daughter there. So I'm done. Thank you so much for your time, and I'd love to answer any questions if anyone has any.
Thank you, Ms. Kari, for your presentation. I really enjoyed that. And again, if you have any questions for her, you can post them in the chat and we will be answering those at the end of our webinar. We'll also be posting everyone's email, all the speakers' emails at the end. So if you have any questions for them, you can email them as well. And also this session is recorded. So if you like a copy of the recording, we can send that to you as well. We're moving right along to our next speaker. Again, thank you for the amazing session that you presented. And we're going to go to the next speaker, Miss Candace Williams. So Miss Candace, are you ready? And you are up on deck to speak.
Yes, ma'am. Thank you, Dawn. Okay, I'm going to share my screen. Okay, can you see my screen?
Yes, are you able to enlarge it just a little bit?
How's that?
I think you might have to switch to display settings, just to swap it out so you can see your full screen at the top left.
That
There
fix
we
it?
go. Yep, that's great.
Perfect.
Thank you so much.
Thank you. So, hello everyone. My name is Candace. I am a dental assistant supervisor at the Lawton Indian Hospital in Lawton, Oklahoma. I am of Comanche, Kiowa, and Apache and Delaware descent. And for the past 10 years, I have worked in Native country as a dental professional, ranging from dental assisting, community outreach coordinator, and clinic management. I have a bachelor's of science in healthcare administration and ethics from Mid-America Christian University. I also sit on the Indian Health Service Oral Health Field Advisory Committee as the dental assistant representative. I enjoy volunteering my time working with programs that promote oral health, such as Native Oral Health Network, remote ambulatory medical events, and local tribal community events. Let's see. Okay. So moving on, to start off, we are very active when it comes to combating against early childhood caries. And so we do a lot of collaborations with other departments in our facility. And Kari gave us a good background about early childhood caries. Our pediatrics dental program is designed to enhance knowledge about early childhood caries prevention and early intervention, not just among dental professionals, but also all healthcare professionals and community partners. It remains top priority for IHS, tribal, and urban dental programs because prevention is key and it continues to promote best practices. So we work closely with our pediatric department within our hospital's facility as part of their routine well-child visit. At the routine well-child checkups, a medical or dental staff member identifies infants and children at increased risk of oral health problems. They educate the parent or guardian the importance of establishing a dental home, and they provide oral health screening and apply topical fluoride. They also provide a patient with a dental appointment with our pediatric dentist. The goal with our collaboration is to make it easier to obtain dental access for children. We assist caretakers with establishing a dental home and a routine recall system, meaning children having a routine dental visit every 3 to 6 months, depending on their oral health needs. As dental professionals, we know American Indian Alaska Natives experience the highest oral health disparities. We are spreading the good news to let children know tooth decay is preventable. We are having fun with it. We partner with public health nurses to attend community health fairs, job fairs, and other tribal events. We prioritize high-risk populations such as youth and women's shelters, and we provide education and oral health screenings ranging from Head Start programs, daycares, and school. Pictured is Head Start students visiting our clinic. We create hands-on learning stations, and this helps children have a fun learning experience and also have fun when they come to the dentist. So as you see, they're getting dressed up in the PPE. It's a very hands-on learning experience. And we do this yearly. Next is our school age efforts to increase oral health literacy within our communities. Our clinic partners with the Oklahoma Dental Foundation and Delta Dental programs. We provide oral hygiene and nutritional counseling through many different programs, such as mass attendance in school auditoriums or cafeterias, tribal youth after-school programs, summer youth programs such as job readiness programs for teenagers. And we also do school sealant programs. We apply sealants on primary and permanent molars, and we target molar eruption on age-specific children. Yearly, we try to reach rural schools in our southwest region of Oklahoma to promote oral health and with this interactive learning experience for school-age children. The students really enjoy it. They get to participate and yell and sing. And after each session, students are given a fluoride application and oral hygiene supply to take home. Your mouth is a window to your overall health. Our dental staff volunteer to participate in a variety of community events. Pictured on the right is us riding in a parade of one of our surrounding tribes. Our float this year was of an Indian guy, and we named him Filbert. We gave him a healthy Indian smile and braids. We wanted to make sure he was ready for the 9 later that evening. Just kidding. But this parade, it was a very proud moment. It was this past year. We were handing out candy and water on this day, and children were running up to the float asking for water. I mean, we were like, "Do you not want candy?" And they were like, "No." So it's very nice and reassuring to see that kids are gravitating to water and not the candy, and that our efforts are, we're seeing the benefits of our efforts out in the community. Dental assistants are leading the way. Our clinic is unique. Our providers are not from our communities. Most of them drive every day for almost an hour to get to work. We are very thankful they make this journey every day. With that said, our dental assistants are the ones leading outreach efforts. And this includes evenings and on weekends. Assistants, they volunteer from the Lawton Indian Hospital. They deliver water, oral hygiene supplies such as toothbrushes, floss, and paste, and prizes. On this specific day, it was another parade that we were doing. Again, we're from the community and we are able to identify with the barriers. We've experienced those barriers. And we're consistently looking for ways to assist with making it easier to help meet the oral health needs and provide them supplies. Dental assistants are creating opportunities to also build relationships with patients outside of the clinic. We are trying to rebuild those positive relationships with patients and advocate for them when they are experiencing a hard time accessing the basic oral health needs. We recognize children are being raised by a village. This includes their parents, their aunties, and their grandparents. We are bridging the connection between provider and patients. Good news is the oral health of American Indian and Alaska Native adult dental patients continues to improve. IHS recently published a data brief back in November of 2022 regarding American Indian and Alaska Natives oral health status. There is a positive trend displaying improvements of fewer adults experiencing untreated decay and more adults having functional dentition. So I have attached the link in this PowerPoint and I'll send it to Dawn so she can give it to you guys if needed. But kudos to everyone working hard to improve the overall health and wellness of Indian country. We are seeing the benefits of everyone's contributions. It's so excited to see the improvements of oral health status. And I've added the status of adult patients because these surveys have been conducted since the 1980s and 90s. Infants grow into children, then into adults, and then into elders. As Pam mentioned earlier, oral health is related to overall health. When we know better, we do better. We're able to position ourselves into healthier societies, and that contributes to our overall wellness. Thank you.
Thank you again, Candace. And that is an amazing presentation. I love seeing the all the wonderful things that the Lawton Indian Health Center is doing for the tribes in the area. And this is what we're reaching for, is that we hope that some of these models can project to the other tribes. And this is what part of NIHB does, is to help assist getting these access programs started in different areas that especially needed, especially in rural areas. So thank you for your presentation. And again, I will post Candace's information at the end of the webinar, and you'll have her email if you have any questions, or if you like to ask a question in the chat, you're more than welcome to put that, and we will try to answer it at the end of the webinar. Thank you again for everyone coming on, and we're going to go ahead and move on to our speaker, Miss Juanita Simpson. We'll have her get started here, and you have the floor, Miss Juanita.
Okay, thank you. We've had a lot of good presentations, and some of my presentation might be redundant. And so to honor your time, there are some places that I may skip through so that you don't hear the same message over again. But I think there's some good graphs on there that are beneficial and some other ideas. With that being said, I should say Chokma, greetings in Chickasaw, and go ahead and get my slideshow going.
Okay, let me get this open. Sorry, we had technical issues this morning, so let me get that for you. Okay, is we thinking? There we go. Can everyone see this? If you can, just put a yes in the chat.
So we're ready?
I believe we got you going.
Okay. Well, I'm talking about early childhood caries in Indian country, and I feel like it's an honor to be invited to speak here. I worked for 23 years on a reservation, and currently I work for Head Start for Region 11. I am a dental hygiene liaison for Head Start for Native Americans and Alaska Natives. So with that being said, I want to get moving along because I know that we probably don't have a lot of time. I want to tell a short story before I get going, though. A lot of what I'm going to say is very heartfelt. Many years when I started working, we did Head Start screenings, and we tried to do makeup screenings, catch those children that we weren't able to see the first, second, third time around. Well, we were on the fourth and fifth time around trying to catch up with a young child that we just couldn't seem to get him while he was there. So one day he was there, and so we went to do the screening, and he opened his mouth, and the dental assistant excused herself, and I continued on with a poker face and charted his needs and treated him just like any other child. And every tooth in his mouth had decay, and he had abscesses throughout. And so the dental assistant, when she came back, she whispered she had been crying. And we didn't have a pediatric dentist, and so we needed to make sure that he got what he needed. And again, this was through Head Start. And we got him a pediatric dentist, and we got the parents connected, and we got them transportation. And the pediatric dentist extracted every one of his teeth. And I know that he had been gone so much because he was having fevers and did not feel good. The dentist at our facility felt bad, and they made him dentures, but the other kids made fun of his dentures, and so he wouldn't wear them. But when I talk about early childhood caries, I like to share that story because I think we don't see the extreme too often, but it can reach the extreme, and death can occur when it gets too severe, and has occurred in children and adults. I'm going to focus more on an adult here, a truck driver that was trying to make it home to his family and dentist because he had a toothache, and he died at a truck stop because he had swelling up around the eye, and there's an orbit around the eye with the foramen at the bottom, which is a hole that goes into the brain, and that infection went into the brain. And when people die of a toothache, that's what's happened, is the infection has went into the brain. And so, it can be life-threatening. And I'm really, really proud of Indian Health Board and a lot of the initiatives that they've made. More recently, the Oral Health Initiative In 2018, a maternal and child oral health resolution for making this a priority. And again, it's my honor to be here. So my objectives are, and some of this we've already covered, explore why primary baby teeth are important, define early childhood caries, examine the impact of ECC on children's oral health, overall health, and ability to learn, explore how to prevent ECC, identify access points for obtaining oral health care. This is a dental therapist up in Sonomish community. We talked about eating. You can't eat an apple, you can't eat steak, you can't eat pizza if you don't have good teeth. And so, of course, the nutritional value is going to go down if you don't have good teeth. You need your teeth to eat good food. Talking, saying the word the, and many other words count on your teeth. So to talk well, you need your baby teeth. We talked about holding space for permanent teeth. Children know, they know when they're different. They know if they've got cavities and the other kids don't. They know if their talking is funny or they're not able to eat like the other children. Of course, their self-esteem is going to be affected. And keeping your permanent teeth healthy will lead to less bacteria in your adult teeth. So defining ECC or early childhood caries, it's decay in one or more teeth in a child under 6. That's what ECC is. The tooth decay process, a baby is not born with bacteria. They acquire that bacteria. 80 to 90%, they acquire that bacteria from the mother, 80 to 90% of the time. So the decay process starts with the bacteria, sugar that turns to acid, and the acid eats away on the teeth. But there's other parts to this. Eating frequently, foods high in sugar or drinks high in sugar will cause acid to attack your teeth within 20 to 45 minutes. So if you're eating something with sugar at 6 o'clock, 8 o'clock, 9 o'clock, 10 o'clock, 11, 12, you're having frequent acid attacks on the teeth. And what that means, if you were to take out a bucket of acid and throw it on something throughout the day, every day, sooner or later, that bucket of acid is going to eat away what you're throwing it at. And that's the same with your teeth. If you're having frequent acid attacks, sooner or later, that acid's going to eat into the teeth. Pain and discomfort, we talked about that a little. Poor weight gain, misaligned teeth, speech development, self-esteem, abscesses, fever, and death. And I covered most of these type of things when I was talking about my story about the young child that had missed so many days at Head Start. Certainly it does happen. So we already discussed high risk for developing tooth decay and permanent teeth. We did not discuss the fear of oral health care. Nowadays we try to be kind to our patients and to children. We really go all out to make it a positive experience. But it's really hard to make it positive if you've ever had to have a tooth fixed and you're a child. We do surgeries nowadays so that the children see a more positive view of the dentist and don't remember what they went through with discomfort. If you've got a toothache, you're not going to be able to concentrate and learn because you're up all night, off and on. I know all of us, they're not all of us, but many of us have experienced toothaches. It's hard to concentrate and learn. If you're up throughout the night and the next day and you can't eat, you're just miserable. It's hard to concentrate and learn. We know that children from families with low incomes have 12 times more absences than children from families with higher incomes. It used to be the #1 reason for children missing school was toothaches. I do not know if that still stands, but it's probably right up there still. And when you're in pain and discomfort and lack of sleep, of course, there's going to be challenging behavior. It may be that you act out, a child acts out, or maybe they can't look at you. I mean, it's going to affect their behavior. So oral surgeries are done a lot on children with multiple cavities, and there's a real wide variance in the cost. It really depends on what type of anesthesia is used. They have what's called conscious sedation, and then full sedation with an anesthesiologist, whether it's done in the office or whether it's done at the hospital. And how many cavities were fixed and how long the procedure took. So the costs are all over the board. We know, and this was said earlier, that we've seen a reduction in decay in ECC, 5% reduction nationwide in Indian country, and untreated tooth decay, 14% reduction, which is wonderful to see. And then there have been some areas that have had greater reduction. On Navajo, 24% reduction in ECC. Oklahoma City, out there by Lawton somewhere, I suppose, 45% reduction. Phoenix, 25% reduction. So there's some areas that have had very successful programs. Prevalence of ECC among children ages 3 to 5. So let's look at this. White children, 25% decay, ECC, Black, 30%, Mexican American, 42%, AIAN children, 71.3%. We've come a long ways, but we still have a ways to go. So American Indian, Alaska Native children are almost 3 times more likely to have early childhood caries than white children. So we talked about care. Even when your child's a baby, wipe their gum with a soft, damp cloth once a day. It cleans the gums, gets you started on good habits, and also reduces the bacteria in the mouth. Don't put your baby to bed with a bottle or sippy cup with anything other than water. Brush your child's teeth with a rice-sized amount of fluoride toothpaste in the morning at bedtime. Keep it a rice-sized amount, because if children get too much fluoride, that their permanent teeth can become discolored. So you want to make sure it's a rice-sized amount of fluoride. Serve snacks without added sugar, and visit the dentist by age 1. Prevention for children age 3 and over. We talked about some of these things already. Brush your child's teeth twice a day with a pea-sized amount of fluoride toothpaste, like the size of your little fingernail or less. A pea-sized amount of fluoride toothpaste so that you don't get too much fluoride that can cause problems with the permanent teeth discoloration. Serve milk at meals and water when your child is thirsty. Serve snacks without added sugar. Take your child for a dental visit at least once a year. Early childhood caries is complex. There are many things that can cause early childhood caries. These are just a few of them. Oral health education. We want the parents to be well educated and their extended family. We know that grandparents and aunts help with raising children, so we want them educated too. Water, access to safe drinking water with fluoride. I would say access to water, period, is huge. We have a lot of water deserts that we don't think about. Areas in the US and Alaska that do not get a lot of water to drink. The water is limited. And having access to water is very important. Nutrition, access to health and affordable foods. Again, we've heard the term food deserts. There's a lot of rural areas on reservations and throughout the nation where there are not a lot of healthy and affordable foods available. And again, those would be called food deserts. Oral health care, access to dentists and dental clinics. And we have talked about the shortage. There is a huge shortage. And we want children and mothers to have access to dentists and dental clinics. This just shows the shortage. According to HRSA in 2021, nationwide, we were short 10,822 dentists. And those dark purple areas, including Alaska, are areas where the severity is the most. And the circles indicate where there are reservations located. Not all the reservations, but it's just to make a point. A lot of reservations are in those rural areas where there are less dentists. Ways to find oral health professionals in Indian country, tribes and corporations that contract their dentists, IHS, and I put regional dental support centers, not because they have a dentist, but because they know the location of all the Indian health centers. And they know which tribes contract their dentist. And just in general, finding oral health professionals, community health centers, dental schools, free clinics, health departments, mobile dental programs, private practice, and volunteer clinics. And I would like to end saying the future is bright for addressing early childhood caries. We have silver diamine fluoride out there. You may not like silver diamine fluoride, but it is quick and easy. And across the nation, it's being used on children, not just on reservations, but in private practice as well. Teledentistry, it's been out there for a long time. The dental therapists in Alaska, for 20 years, they've been using teledentistry, and we're seeing it more and more in mobile units down here in the US. Dental therapists, God bless you. I'm so glad to see it happening. It's more in the Northwest on tribal lands right now, but it's out there and it's coming, and it's only going to increase the access. So there's a lot of resources listed here. As I've said, you can have a copy of this presentation and get these resources. I'm not going to go through them all. And then, so if you have any questions at the end of these presentations, feel free to ask. And I want to leave you with this thought. What more can American Indian Alaska Native communities do to prevent ECC? What more can we do to prevent ECC? If you have any ideas or thoughts, please bring it up at the end of the presentations today. Thank you so much. And I'd like to say a special thank you to Beth Lowe, who also helps me with my slideshows. And that's everything I have today. Thank you.
Thank you, Ms. Juanita. I greatly appreciate you taking your time to show us this presentation, and thank you very much. Again, to everyone watching and coming on today, I greatly appreciate you taking your time to stick with us and listen to our wonderful presenters on today's webinar. Again, we really want to focus on National Children's Oral Health Month and Maternal Health Month too, and just celebrate that in our communities. So if you have any questions at all, I'm going to share a slide here, and it's going to have information of our speakers and some resources that you may be able to refer to. Then if you just give me just a second and I will get these up. Okay, so can everyone see the screen? Just you can just put in the chat for me if you can see the screen pretty well. Thank you. All right, so here's one of the resources that we have, a list of some of the resources, and I will have Ms. Liv kind of explain a little bit real quick on her project.
Hi, thank you so much, Dawn. So these first two are some resources that we'll drop links for in the chat. We also wanted to uplift the Hear Her resources. The Hear Her campaign by CDC has created an American Indian Alaska Native segment that has a lot of free resources that soon should also be available for order for free online. On the left-hand side, you can see an example. So they have some really great AIAN maternal health resources that might be relevant to the work you're doing. And I also put in here our subpage for the maternal health team. And you can find our technical assistance request form on the left-hand side of that page if you have any questions or want to connect further on the maternal health side.
Thank you, Liz. And then our next resource that we have, again, is just our emails from all our presenters. You're more than welcome to take a screenshot of those. Again, we will post these. This session is recorded, so we'll have a copy of this recording. And then also, I did put my email in the chat. So if you'd like to email me, we're more than happy to send you a copy of these resources. And again, I greatly appreciate everyone taking your time to be here today. Just a reminder, the National Indian Health Board has a tribal health conference coming up this May. Early registration ends today. So if you're still able to register, please do that. And I greatly appreciate, again, everyone taking our time to come on today and just listening to our sessions. Again, if you have any questions, then we'll make sure and try to answer those for you at the emails. But if you don't have anything else, all my presenters, thank you very much again for taking your time and sharing your wonderful presentations for us. And just taking your time. And if anyone would like to ask any questions, we'll give just a couple minutes for those. So anyone would like to ask anything in the chat or like to be unmuted, just if you can do a little hand raise sign on the reactions, or just ask it here in the chat. We'll just give a couple of minutes for the questions. Or comments. Again, if anyone has any questions or comments from any one of our presenters, please either post it in chat or just let me know and I can unmute you. Yes, and thank you, Ms. Pam, for taking your time to come chat and visit with us today. We, as the National Indian Health Board, greatly appreciate everyone taking their time to come on board and just listen to us. Be looking forward for some more future webinars from us. And again, thank you. I'm going to go ahead and close out our meeting or our webinar for today. Again, this will be recorded, so if anyone needs this webinar, feel free to email me, which I will put my email again in the chat, and just reach out. Thank you again. Everyone have a great day, and you're more than welcome to go ahead and sign off on the webinar. Again, thank you to all our speakers, and you have a blessed day.